Okay, before we move on, I want to share an overview of this pilot. Over the last 12 months, we collaborated with many stakeholders about how best to tackle the childhood obesity epidemic. And from all the conversations and meetings that we held, we determined if we could find one school to work with that would allow the campus environment to become infused with health, nutrition, and fitness strategies, we could then measure those outcomes to determine whether or not it could become a replicable model for other schools. Research shows that healthier students are better academic achievers, so we really felt confident we could find a school that would be interested. We were introduced to Carrie Tapley, and she jumped on board immediately, as did Sean, her superintendent. And so we've been asked by a lot of people, well, now why did you pick Morrilton Intermediate School? And the answer is because of the leadership here. Really, it's truly your willingness to invest in your staff and in your students. It's not because the campus was the most unhealthy. I think people thought, or the students. Really, truly, your students are actually healthier than the state average. But it's the leadership. And we do understand that schools face countless demands and pressures, and we do not want this pilot to be a burden, but instead, please consider it our gift to you, to your students, and to your community. So what will this gift look like? The pilot is evolving, but currently plans include assessing the student fitness levels through FitnessGram, plus the school will also be implementing the award-winning Spark PE curriculum for PE classes in recess. We also plan to build gardens both inside and outside the campus, with the produce to be shared with the students, staff, and also parents. And if you haven't heard of aeroponic gardens, check out the poster over there of a tower garden. We're ordering 3 for the school, 1 for each grade level. We're also planning field trips to the Arkansas Heart Hospital garden to give teachers and students a vision for your garden that will be built outside. Learn at lunch presentations will be provided to the teachers and students, plus some of the teachers are going to be integrating nutrition education lessons presented by Arkansas Children's Hospital. We also plan to integrate decision-making lessons and activities because every day we make decisions about our health. We will also be offering cooking classes for parents and students later in the school year, and so plus we want to work with the cafeteria staff to determine what kind of healthier options might be available. And one more thing, Sarah, I think you and your staff and students will be excited about. We are planning to provide incentives and rewards for y'all when you meet the challenges. We're also working on a year-end celebration for the school. It's our way of saying thank you for blazing the trail for K-12 Health Revolution. And if you haven't seen Blaze, that's our mascot. Blaze represents a child carrying the torch for their own health. I personally have a passion for this mission. I was obese as a child. I get why this pilot is so important. All children want to grow up and be happy and successful adults. But with 40% of our children today at risk of grave future consequences if we don't reverse this epidemic, all Arkansas children are going to be the beneficiaries of this pilot, so the stakes are very high for this to succeed.